Specialty Stories, session number 22. Whether you are a pre-med or a medical student, you've answered the calling to become a physician. Soon you'll have to start deciding what type of medicine you'll want to practice. This podcast will tell you the stories of specialists from every field to give you the information you need to make sure you make the most informed decision possible when it comes to choosing your specialty. Welcome to the Specialty Stories podcast. My name is Dr. Ryan Gray, your host here, as well as many other podcasts. Check out everything that I do and we do at mededmedia.com. That's MEDED media.com. If you are a pre-med student and you are getting ready to prepare for your medical school interviews, or if you were not going to prepare for them for a year or two, go check out the Pre-Med Playbook Guide to the Medical School Interview. It is being released in paperback form on June 6th, 2017, and right now I have a pre-order special where you can get about $100 worth of goodies, freebies, if you pre-order the Barnes & Noble paperback copy. Now, the freebies are 1 month access to a brand new awesome mock interview platform that is right now only available for those that pre-order. And the other thing is access to my 13 video course on the medical school interview. So if you are interested in that, for $14 roughly to get the paperback copy, to get $100 worth of free stuff and access to an amazing new platform, again, which you can use at any point. So if you're not interviewing until next year, go pre-order the book and let me know that you want access to this platform next year and not this year. But you can text the word pre-order, that's PREORDER, pre-order, all capital letters, to 44222, and I will follow up with instructions in your email on how to do that. All right, on to today's show. Today's show is going to be a little bit different. It's a little crossover type show. I'm actually being interviewed by Ian Drummond, who is a fourth-year medical student, who is the host of the Undifferentiated Medical Student. And Ian interviewed me back in episode 24 of his podcast, all about Aerospace Medicine. Now, if you haven't heard Ian's podcast, you should. Again, the Undifferentiated Medical Student is the podcast at undifferentiatedmedicalstudent.com. The episode I was in is episode 24. Ian's interview is a little bit different than mine for Specialty Stories. So what I'm going to do is I'm going to play just a part of his interview with me, the part that relates specifically to aerospace medicine. If you want to go listen to the whole episode, again, go check it out, undifferentiatedmedicalstudent.com, and it's episode 24. So I hope you enjoy this episode, again, with Ian Drummond from the Undifferentiated Medical Student.
Now is a perfect time to transition to the first part of the interview, where I basically ask you to tell us everything about aerospace medicine. And the way I like to start this part of the interview is usually to read you a description from the Careers in Medicine website, which is hosted by the AAMC. But in this case, the Careers in Medicine website actually didn't have a description of aerospace medicine. It had, it listed aerospace medicine under Preventive Medicine, but it didn't have a link to it with the usual description of the specialty. So you helped me find one from the Aerospace Medical Association, which is at asma.org if other people want to go look it up. So I'm going to read that, and then I'm going to ask you what you think of that description, and then we'll take it from there. Aerospace Medicine, a subspecialty of Preventive Medicine. Aerospace medicine concerns the determination and maintenance of the health, safety, and performance of persons involved in air and space travel. Aerospace medicine, as a broad field of endeavor, offers dynamic challenges and opportunities for physicians, nurses, psychologists, bioenvironmental engineers, industrial hygienists, environmental health practitioners, human factors specialists, psychologists, physicians' assistants, and other professionals. Those in the field are dedicated to enhancing health, promoting safety, and improving performance of individuals who work or travel in unusual environments. The environments of space and aviation provide significant challenges such as microgravity, radiation exposure, G-forces, emergency ejection injuries, and hypoxic conditions for those embarking on their exploration. Areas of interest range from space and atmospheric flight to undersea activities. The environment studied over a wide spectrum extending from the microenvironments of space to the increased pressures of undersea. Oh, I read that. Increased knowledge of these unique environments of spaceship Earth helps aerospace medicine professionals ensure participants are physically prepared, physiologically safe, and perform at the highest levels. How much of that do you agree with, and what would you add or subtract to ensure that anyone listening was well informed about aerospace medicine?
I agree with all of it. It's a great representation, obviously, from the organization that kind of runs
right from the source. I'm glad to hear that.
Yeah, right from the source. I think one of the biggest things that is missing, which is unique to aerospace medicine, is the relationships with patients is such a huge factor in aerospace medicine that I think it deserves its own kind of call out there as well. Mm-hmm.
Can you give me an example of that? I mean, many specialties have, relationships, but why would it be that these relationships are extra important in aerospace medicine?
So as an aerospace medicine physician, as a flight surgeon, and I'll speak specifically to the Air Force because that's my experience, but it's similar for the Army and Navy. And they do have civilian flight surgeons. You can have AMEs out in the real world that do physicals for airline pilots and other pilots as well. So so there is a civilian equivalent. It's just a little bit different for the military, but for the military, specifically for pilots, let's just talk about pilots to make the conversation easier. A pilot, when they go and see the flight surgeon, they usually are seeing the flight surgeon for one of a few things. One, it's their mandatory kind of annual physical, and they're crossing their fingers that nothing is found. Or two, something is really wrong and they need help. A pilot doesn't typically want to go see the flight surgeon outside of those two things, because every visit to the flight surgeon is an opportunity to lose their wings.
Yeah.
And by lose their wings, I mean no longer be able to fly. And so because a flight surgeon has that control, and it's not that they want the control, it's just our job to make sure that pilots and other people that are interacting with aircraft make sure that they're safe operating that aircraft. And so it's our job to make sure that if they have a medical condition, we need to determine if they should continue flying or not. And just a brief kind of side story for my story, I experienced this as a flight surgeon. I was a rated flyer. I got to wear a flight suit and had wings, and I was required to fly 4 hours a month to be part of the air crew, to build that rapport, build that trust. I went for an MRI one day because I was having some weird symptoms and a diagnosis of MS a little bit later. I was no longer allowed to go up in an airplane.
Oh, wow.
For the Air Force. So because there's that fine line between you're allowed to fly and have your career, or you're not allowed to fly anymore, let's figure out something else for you. It's such an important relationship to have that trust, have that rapport, and it's one of the best parts about being a flight surgeon.
Oh man, so I can see how trust is extra important, and because I imagine that they probably hide things from you unless they
they do hide things from us. It's a cat and mouse game. It's like Dr. House in House, the TV show. Yeah. Patients always lie. Yeah, well, kind of in the aerospace medicine world, they probably are, because they want to. Flying, it's weird. Pilots and navigators and loadmasters and everybody else that's on the plane and working on the plane, they love their jobs, and they love that. They love the camaraderie that comes with it, and everything else. And it's a huge part of who they are.
Very interesting dynamics. And I didn't realize that's how you discovered that you had MS, which, by the way, I hope is a mild case and remits frequently.
Thanks.
But I'm sure that sucked to have your wings pulled from you.
Yeah, like you're grounding the flight doc. Like, how dare you?
Yeah.
I was kind of pissed. Like, you can't ground me. I'm the flight doc.
Oh, man.
But yeah, it's a hard thing, but it is what it is. I personally thought it was a stupid rule for me. It's interesting. MS is one of those weird things for aerospace medicine. The Israeli Air Force is a little bit more progressive than we are, and they let pilots fly with MS. Our Air Force is a little bit less progressive, and they worry more about the cognitive decline. That it's like 75% of MS patients have some sort of cognitive deficit, and so I think that's what our military worries about.
Mm-hmm.
Less so than whether you have any sensory motor deficits. Obviously, you still need to be able to fly the plane. But for me, I'm like, I'm the flight doc. I'm not flying the plane. I'm just hanging out and building rapport and building these people's trust. So yeah, I argued for a while, but I lost that argument.
Bummer. Sorry to hear that.
That's all right.
So now that we're actually talking about it, one question I have is, do flight surgeons, when you say you were up there flying, were you actually piloting the plane, or were you just up there, in the back seat? And,
so
do flight surgeons actually learn to pilot?
There are a couple caveats. In the Navy, flight surgeons typically go through some of the pilot training courses that the pilots go through. So they're trained a little bit more. The Army, I don't think, does that, and the Air Force does it a little bit, and the Army may do it like the Air Force, where you go through a little bit of ground training, ground pilot school, and it's just part of the exposure to say, hey, this is what pilots are going through. Let's go up in a small little Cessna type plane and go fly, and you can fly and see what that's like, because you need to, again, the whole point of a flight surgeon is to make sure that pilots and other people can do their job if they have a cold or if they have a knee sprain or whatever. So you have to understand what they're going through.
Yeah.
And so they throw you up in a plane. They give you some ground training and throw you up in a plane with an instructor pilot, and you fly around in a little plane, and you see how much there is to do. It's a lot of overload.
Yeah.
And I have my private pilot. I got my private pilot. I've always been fascinated with airplanes, and so when I had the opportunity to get my private pilot, I jumped on that. And so
nice. I would love to do that.
It's awesome. When I say that as a flight surgeon, I had to fly 4 hours a month, that's usually I'm referring to just being part of the air crew. And so the majority of aircraft that I was in are bigger airplanes, and so I would just kind of hang out in the back, or you're hanging out in the cockpit, but not actually controlling anything. Sometimes I would talk on the radio and help them with the radio stuff. The one time I did get to fly something, I was in the back seat of an F-16, and because the controls are right there, it's a little bit less weird than a pilot in a bigger airplane getting up and out of the way so that you can sit down. Because if anything were to happen, then you'd have to get up, and so it's a lot less to worry about in a fighter jet. Because you have the controls there, and the pilot's still there, and he has controls. So I got to pilot an F-16, so that was pretty cool.
So you're basically a fighter pilot. At least you get to say
basically, I have a selfie of me in a fighter jet. So
I am so jealous.
That's what I lead with.
That's awesome. So just a quick clarifying tangential question is that, so when you say that you have wings, that can mean either you have wings to actually fly the plane yourself, or you have wings to be allowed in the aircraft even as a passenger.
Yeah, so wings, when you have wings, it means you're rated, I guess you could be non-rated and have wings. It means that you are in some way affiliated with the airplane. Pilots have wings, loadmasters have wings, navigators have wings, flight surgeons have wings. Who else has wings?
I see. So it's not just the pilots.
It's not just the pilots. Yeah, having wings is just a designation that you're kind of like the real Air Force. You're like part of the plane, because in the kind of the civilian world, if you tell somebody that you're in the Air Force, it's like, oh, you fly airplanes? It's like, well, no, I drive a bus, or I'm a cook, or I'm a doctor, or whatever. Like, the Air Force is just a big corporation that has lots of jobs, and a very small percentage of those people actually have wings and fly and do all that stuff. So it's a fun misconception out on the outside world.
Yeah, and I'm definitely from the outside world. Well, great. That was phenomenal. I didn't know any of that, so I'm glad we clarified that. And I'll just say I was doing some reading online, and the 4 hours that you were referring to, I think this was actually on the Navy website that I was reading, that you're required to do these 4 hour not operations, but have 4 hours with the squadron, they were saying. But basically for the reason that you initially were talking about, like the trust. You not only trust, but you have to know what they're experiencing, and that's why they have you do at least 4 hours.
Yeah. So it's one of the reasons kind of I initially mentioned the difference between a civilian physician who's seeing a patient. Let's talk about a primary care doctor. Their patient comes in with lower back pain or knee pain, and it's like, okay, great, go to physical therapy. And there's usually almost never any sort of thought about, well, what job does this person do?
Yeah.
Can they continue to do it? Usually the person's asking for some time off because they don't want to work. That's a different story. But in the military, as a flight surgeon, that's always the first question at the top of my mind. Yes, I care about the knee pain. I care about the back pain. Let's think about that and get you better. But I have to know what your job is and whether or not you can continue to do it.
Yeah.
So if you come in with knee pain and you're a pilot, and I know that if an engine goes out and you need to push full rudder to keep the plane straight and land it, that you're probably not going to be able to do that with how bad your knee is. Let's ground you for a week or two, make sure your knee's better, come back and see me, and we'll reevaluate.
Got it. Thank you for that. So if you have nothing else to add off the top of your head, I'll just dive into my first question.
Let's go.
So you are, actually one more clarifying question. If you, I just want to see how the terms flight surgeon and aerospace medicine relate. So is someone who practices aerospace medicine necessarily a flight surgeon, and is a flight surgeon necessarily someone who has training in aerospace medicine?
Yes and yes.
Okay. As
far as I know.
Okay.
There may be some random caveats, but yeah, it's interesting. There is no such thing as flight surgery.
Right.
A flight surgeon is just an old cool name that has held out for a long time, and the actual practice is aerospace medicine, and there are aerospace medicine residencies. But you are a flight surgeon as an aerospace medicine specialist.
Got it. So there is flying, but there is no surgery, and there's definitely no surgery while flying.
Yes. The only people operating on airplanes are mechanics.
Okay. Important clarification, because I didn't quite realize that was the case when I first started looking into this stuff. All right. So my first question is, and this is going to be for you in the context of an Air Force flight surgeon. What does a typical weekly routine look like, or what did a typical weekly routine look like for you? What is a typical series of patients that you would see, and what would be a typical series of outcomes for these patients?
So a typical week would look like any other specialty, an office-based specialty, so ambulatory setting. You're seeing patients, and it depends on what base you're stationed at as an active duty flight surgeon. Some bases you see dependents, meaning the family members of the active duty member. Some bases you see retirees. So it depends a little bit on the types of patients you're seeing, but you're seeing normal clinical stuff. You're seeing a lot of occupational health visits. So when a pilot comes in for their annual flight physical, it's an occupational physical. We're checking their vision, we're checking their hearing, we're checking other things, just and making sure they're obviously healthy otherwise, but a lot of it is just more occupational based, making sure that they meet the qualifications for continued flying. If we're seeing dependents and retirees, we're basically a family practice person, a family practice physician, and so we're treating family members for normal aches and pains and colds and other stuff that a family practice physician would be seeing patients for. A flight surgeon is it's a cool job because depending on where you're at, the majority of your time, or I guess it's about 50-50. 50-50 seeing patients, or 50% seeing patients, and 50% hanging out with air crew and building that rapport and doing what's called shop visits. You're an occupational health physician as a flight surgeon. And so you're visiting, if you're at a base that has airplanes, and you're visiting the flying squadron to make sure things look good there and things are clean, the facilities are clean. You're going to the maintenance squadron and making sure that people that are working on the airplanes are keeping a clean environment and not working with lead-based paint and bringing that into their offices and where they eat and other things. And so you're just making sure that the base is staying healthy. And so a lot of time you're outside of the clinic and interacting with the rest of the base population, which is pretty fun. It keeps things very varied, and so you get a lot of diversity, which is pretty cool.
Yeah. Definitely a lot of different activities, or at least you get to observe them. And when you go to these site visits, do you just have like a clipboard with a checklist and you're like, okay, no oil on the ground or no lead paints or...
Mm-hmm. Yeah. So a lot of them are very structured like that. And it's like, okay, they keep separate wipes for their masks, or they have separate sinks for different things. And yeah, so a lot of it is very structured in that way. And some of it's just using your normal intuition and question asking skills that you learn as a physician, and just trying to inquire about things. And as a physician, you have unique skills of looking into things and asking questions and kind of digging down deeper. So you use that as well.
I can see that. So you're rarely ever doing the work. You're just really in the background observing how others do the work.
Yeah, we're not doing the work of what the actual shop is doing, but we're evaluating. And usually I go out with a team. So I would have gone out with public health or bioenvironmental engineering. They help keep the base population healthy. And so they have their questions that they're asking, and I'm observing, and I'm following up with different questions more focused on the health side and the medicine side. Mm-hmm. So it's a very collaborative, team-based approach when you go out to do these things.
Uh-huh. So taking you back to the clinical side of what you do, the ambulatory care, is it fair to say, and you use the term family medicine doc, is it fair to say that a flight surgeon then, and at least 50% of the time, is basically a general practitioner except of the military?
Yep. Yeah, exactly. And a large majority of flight surgeons are general practitioners, meaning they're only internship trained. That's the way that the Air Force kind of gets flight surgeons, is what happened in my path, and we'll dig into that. But a lot of flight surgeons are fresh out of their internship. There are a lot of flight surgeons that have a residency training, whether it's OBGYN or orthopedics or family practice or internal medicine. You can have any specialty and go and be a flight surgeon if you choose to.
I see. But does that, if you, let's say you have OBGYN training and you become a flight surgeon, do you have to go through all of the aerospace medicine training before you're the flight surgeon?
Oh yeah. Okay. Oh yeah. Because it's so unique and different.
Okay. So it sounds like aerospace medicine is a subspecialty that's available to everyone. And I think on the Careers in Medicine website, it just said you needed to do a preliminary year, an intern year.
It's available to everyone in the military. Yeah.
Okay. Got it.
Yeah. If you want to do that, they always usually need flight surgeons. And so we get a lot of physicians that would jump ship from their specialty, family practice, or their subspecialty and come over to the flight medicine world.
Got it. And so what is a typical outcome for this typical patient, which sounds like it could be any type of patient. Are there any interesting outcomes? I mean, I think one that you've already mentioned is, well, you had to tell the pilot with a certain condition that the condition would result in him losing his wings or her losing her wings. Any other sort of typical outcomes for these patients?
Not really. I mean, typical outcomes, it's going to be just like a family practice doc. You're going to see people with their aches and pains and sniffles and flus, and so you're treating that acute thing for a week or two, and maybe grounding them for a week or two, and then they come back and see you, and things are better. But there are lots of unique things. If somebody's losing their vision or has a random new diagnosis, then there are a lot of bad things that can happen. Obviously, to cause somebody to lose their wings, or as a flight surgeon, you also take care of usually firefighters, because that's another big occupational health job. Mm-hmm. And so you're telling somebody they're not qualified to be a firefighter anymore, which is almost worse than telling a pilot they can't fly anymore. Firefighters are very passionate, and so it's definitely the outcomes are normal. Usually normal, healthy people, but then when you get those random diagnoses, it's a life changer.
Yeah, I'm just trying to relate it to, I guess, other fields, and it really sounds like what you do is very similar to family medicine.
Yeah, it'd be closest to family medicine.
Very cool, thank you. What do you find most exciting about being a flight surgeon or being involved in aerospace medicine? And conversely, what do you find most mundane about aerospace medicine that you tolerate or tolerated to experience the more exciting aspects of it?
So obviously the most exciting is being able to go out and be part of the air crew and go fly around the world, or fly an F-16, or go do those sorts of missions. Going out and experiencing what the rest of the base is doing is pretty exciting. So I think that's the most exciting part. The most mundane part is dealing with, again, normal aches and pains, the kind of boring patients, if you have those. Dealing with somebody coming in with their high blood pressure and trying to manage that, or their diabetes and trying to manage that, and it's just the boring normal doctor stuff.
Got it. What is one thing you wish you had known about your specialty before entering it?
I wish I would have known about it.
Yeah,
again, we'll get into that, I guess, in the second part. But yeah. When I got the call to say I was going to be a flight surgeon, I was like, oh, what the hell is that? So yeah, I don't think there's really anything now that I'm out of it. When I was in it, that I was like, man, I wish I would have known about this.
Yeah.
Other than I wish I would have known about it.
Yeah. Then is there anything that you would recommend that medical students consider in earnest before pursuing aerospace medicine?
I would consider them to do it, especially those that are on an HPSP scholarship, or at the University of Health Sciences, the U.S. Medical School. I think as a flight surgeon, it's an amazing job, and there's so many things that you can do that I highly recommend it. Even if you're interested in a specialty, go be a flight surgeon for a couple of years, and then go live the rest of your life, because the stories that I can tell now, having been a flight surgeon, are going to stay with me forever.
Yeah, no, it sounds pretty cool. For everyone listening, but also me, can you tell me what an HPSP scholarship is?
HPSP is Health Professions Scholarship Program. So it's the program, Ian, I'm sure when you got your acceptance to medical school, it's like, okay, great. And how much are the loans now?
Yep.
So instead of asking that question, I went to the Air Force recruiter and said, here, you pay for it.
Got it.
So it's a program. It's about 150 scholarships a year that they offer. And basically you get into medical school and you apply for the HPSP scholarship, and they accept you or not accept you, and they pay for medical school, and then you owe them. It's a year for a year. So you can do a 4-year or 3-year scholarship.
Very cool. So here's one of my favorite questions, and I think we've covered parts of it already, but how does the practice of aerospace medicine change depending on setting? For example, inpatient versus outpatient, academic versus private versus public, urban versus suburban versus rural. civilian versus governmental versus military, and then even national versus international?
So I think for the purposes of the uniqueness of aerospace medicine, because it's more of a military-based career, I'll divide the two into more kind of non-combat and combat. Okay. So as a flight surgeon, you're, depending on where you're stationed, you can be stationed anywhere throughout the world. You can be stationed at a place without planes. You can. I was stationed at a base with no planes, which is kind of weird for a flight surgeon. But the majority of your job is making sure that the population of that base is healthy, making sure that the population of the pilots and everybody else that's interacting with the airplanes is healthy. It's always an ambulatory setting. There would be no need for an inpatient, a hospital-based flight surgeon. And so that's the kind of non-combat. And then you can have, when you're deployed in a more of a combat setting, you can run as a flight surgeon different parts of the evacuation, medical evacuation triage kind of tents and stations along the way. So when somebody gets injured in combat, they're evaluated and triaged to see if they need to be evac'd out to more of a bigger hospital, or if they can be just treated where they are, or if they need to be sent to like Germany to a big hospital. And it's usually a flight surgeon that is doing that evaluation and then determining, well, what kind of aircraft do they need to fly on? Is this an injury that is going to get worse at altitude, or do they need to stay at low altitude? Do they need to be in a helicopter and stay low, or stay in an unpressurized aircraft at a low altitude? So you're doing a lot of cool kind of triage and trying to figure out what's best for the patient based on aircraft and altitude and other things. So I think those are the two biggest distinguishers for aerospace medicine.
Great. Thank you for that. But at some point, I think you mentioned that you can go into aerospace medicine outside of the military. So what does that look? And then you said that commercial airliners have AMEs.
Yeah. So an AME is an aerospace medical examiner, I think is the term. It's a designation you get certified through the FAA, at least here in the States, and or aeromedical medical examiner, something along those lines. I don't know.
I'll put in show notes.
Yeah, I'll put it in the show notes. Show notes are always the best. But so as an AME, you're usually, again, a family practice doc or internal medicine doc, or just somebody that's interested in aviation. Uh-huh. And it's kind of a cool job because it's usually a cash-based business. And so you say, yep, it's an aviation medical examiner. That's what AME is. And an aviation medical examiner, I will see you for, there's, I think, 3 classes, class 1, 2, and 3. Airplane pilots are class 1 pilots. They need physicals. It's like every 6 months or something. And then there's class 2 and class 3, depending on the designation. I'm not familiar with that side of it because, again, I wasn't an AME. But yeah, so you can be an AME. You have to go through FAA training. I believe the FAA training is free, which is kind of cool because it's a government organization. And so they need AMEs. If you look at the population of AMEs over time, it's decreased significantly. Mm-hmm. And so it's getting harder and harder for pilots to find an AME and get their physicals. And it's very similar to a military flight surgeon. There are strict medical guidelines that determine whether or not you're able to fly, and an AME knows those guidelines and bases your evaluation and your physical on those guidelines and your health, and makes recommendations based on that.
Got it. And this FAA training, is that the same thing as an aerospace medicine fellowship or residency?
No, it's a week-long or 2-week-long course that the FAA puts on.
I see. So you already have to have some aerospace medicine training, and then you take the FAA training?
No, you can be an internal medicine doc and have a practice and be like, I think I want to be an AME.
Oh, okay. I see now. So what if you wanted to work at, say, NASA?
You could be a flight surgeon at NASA. Yeah, I looked into that at one point because I was like, that'd be pretty awesome to be an astronaut.
Yeah, can I fly with the squadron then too?
Yeah, you could. You could be. I don't know what you would do flying wise, but you could definitely. I've been down to Houston to the Space Center there and visited. I think it's the world's largest or second largest swimming pool where the astronauts do all their training for weightlessness. They do it in a huge pool. Mm-hmm. So I've been there and seen that, and it's pretty awesome. So yeah, you could. And as a flight surgeon in the Air Force, I did astronaut physicals. I would see people that wanted to be astronauts, and I would do their initial physicals before they would go down to Houston to get their full physical. So it's like, oh, that's cool. This guy wants to be an astronaut. I want to talk to him or her.
No chance you could do your 4 hours of squadron hangout time in space.
Probably not.
Bummer. Very cool. Is there any other context that I haven't asked about that changes the way aerospace medicine is practiced?
The other aspect, and I think I kind of hit on it earlier, but I didn't dive into it, is you could be a pilot physician, which is cool.
Okay.
And the Air Force, I think, has about 20 spots to be a pilot physician. And I was actually talking with a student that I'm working with. She's in the Air Force right now and wants to go back to medical school, but she's also a pilot, not in the Air Force, but she has a private pilot, has like 600 hours. She flew at the academy on like their like stunt team or something.
Wow.
And so I was like, well, why don't you be a pilot physician if flying is such a big part of your life? She's like, oh, I definitely will look into that. You can, so the typical path for a pilot physician is you're a pilot, and for some reason you get interested in medicine and you go to medical school and you still want to be in the military, you become a pilot physician. So you're a physician first and foremost, but you have the pilot training, and it's such a unique position. And usually you're doing a lot more higher level things. You're not just seeing patients in a clinic, but you're looking at a lot of the regulations that are being written. You're doing research into new technologies. And so that's one aspect that I didn't talk about. And because they have about 20 slots, and it's a highly sought after.
In the entire military?
In the Air Force.
Oh, okay.
Because they don't have enough people filling those spots, not enough pilots are going on to be physicians, surprisingly. They're looking for physicians that may be interested in going to pilot training through the Air Force to be pilot physicians. So that's a cool and unique thing. And I actually looked into it the first year that they were like, hey, we're starting to offer this to physicians to go to pilot training. I looked into it, and I was too old at the time.
Oh, really? What's the cutoff?
To go to pilot training, you have to be, I think it's 29, the oldest to start, and I was already 30 or 31. And so I said, hey, I have my private pilot. I obviously love to fly. This is pretty cool. And they're like, yeah, we're not doing age waivers. Usually we say in the military, and anything is waiverable. But for some reason at that point, they weren't waiving it. So the next year they were waiving it. I think if they were waiving it the year that I was interested, I maybe a different discussion at this point. But I think that the MS would have grounded me either way.
Oh, man. Well, either way, very cool. I did not know that a pilot physician was a thing.
Yeah.
The road to get there, can you be any type of physician, or do you also need to have taken an aerospace medicine sort of fellowship?
To be a pilot physician?
Yes.
I think they were taking any physicians, but you would obviously need to go through the aerospace medicine training at some point.
And then is the unique ability that a pilot physician offers, is it in research, or are there various missions that the military needs to fly where they don't have enough space on a plane or something, so they want, someone who could do two things, i.e. be a physician and a pilot?
It's probably more of the research and more of just having the deep knowledge base and foundation of having both careers under your belt and being able to make those regulations and see things from both sides.
Right. A deeper understanding of both sides.
Yep.
Very cool. Totally insightful for me, all new for me as well. What is one of the biggest challenges facing aerospace medicine, and where do you predict your specialty will be in 10 to 20 years?
Aerospace medicine challenges, I think always one of the biggest challenges is because we're such a unique part of the military, a lot of people don't really understand us. And so when I was talking earlier about this 50-50 kind of thing, you're seeing patients 50% of the time. A lot of times there's a lot of pressure for us to start doing more and seeing different types of patients and help the family practice docs because they're usually overloaded and they see the flight surgeon out gallivanting around the base and hanging out and flying around. And so there's probably a lot of, I don't want to say jealousy, but a lot of misunderstanding of what our job is.
Yeah.
And so I think that's the biggest challenge is that misunderstanding from the greater Air Force behind what we do and what we are.
Are there sorry.
Go ahead.
Are there any manifestations of this misunderstanding that are either good, bad, or neutral? Does anyone ever come up and yell at you or something? Like what happens?
Of course, there's manifestations. The manifestations are your boss tells you that you're going to start seeing more patients that don't really belong to you.
I see.
Yeah. So there's always a battle, and it always helps to have a boss who understands the flight medicine world,
and
aerospace medicine world.
And so I was likening of being a flight surgeon, or at least 50% of what the flight surgeon does, to being a family practice physician. But does the military also have family practice physicians that are not flight surgeons?
Yes.
Okay. So where do you predict your specialty will be in 10 to 20 years?
Where it is now. And it's not going to change much.
Okay.
I think the things that are changing are as we go to more and more autonomous aircraft, autonomous in a sense where we actually have true autonomous drones, but the majority now at this point are remotely piloted. It's funny. There's always this big argument that they're not unmanned aircraft. They are manned. They're just manned in a different location. So they're remotely piloted RPAs, remotely piloted aircrafts. I think the interest in aerospace medicine will go down because of that. Because part of the lure is being able to go fly, and when there is no plane to fly in, then it's like, well, why am I doing this? So it'll be different. I think challenges are different as you get drone pilots that are quote unquote at war during the day and then they're at home at night in their house. I think there are unique psychological challenges that come into play there. We're going to fighter planes, the F-22 and F-35 that are only single seat planes. They don't have. I think the 22 may have one or two dual seat planes, but the 35 I don't think will ever have any dual seat planes.
Meaning that the flight surgeon can't go up there.
Meaning the flight surgeon, exactly. So the F-15 and the F-16, the F-18 in the Navy, as those become more antiquated and aren't used, the flight surgeon gets less experience and less enjoyments going and flying in fighter jets because you can't fly in a 22 or 35. So that'll be a big change. So I think those are some of the challenges. I think we'll always have the heavier aircraft like the C-5 and C-17 and the refuelers, the air tankers.
Yeah. When are they bringing the SR-71 back?
I don't know if they are at all.
I doubt that they are as well. I'm going to put that one in the show notes for anyone who doesn't know what that one is. I don't know many of the planes that you just mentioned, but I had a roommate that he was a systems engineer and he wanted to be a pilot, and he might be a pilot by now. And he loved, I think it's the Blackbird, the SR-71, which is a very sexy looking jet that I think is one of the fastest ever built, if not the fastest.
Yeah. We got the B-2 kind of replace that one.
Oh, okay. Is there anything that I haven't asked you about aerospace medicine that you think people should know?
Um, it's awesome.
It sounds very cool.
It's a great job. I'm serious. And we'll get into how I got there, but it's an awesome distraction for a couple of years before you start your real life. All right, there you have it. All about aerospace medicine. Now, aerospace medicine, obviously, pretty much specific to the military, although there are civilian residencies for aerospace medicine. But my goal is not for this podcast, for Specialty Stories. I don't think I'm going to dive into all of the medical specialties. And that's for two reasons. Number one, the practice of pediatrics in the military is not very different than pediatrics in the civilian world. So the medicine practice isn't very different. And honestly, really there just aren't that many military pre-meds out there, I don't think, to warrant doing individual episodes. So to do an episode of military internal medicine may benefit 100 students, but the other 2,000 will be like, I don't care about military stuff. So I'm not giving up on the military side of things. I am a huge advocate and evangelist for joining the military to pay for medical school and to serve and to be part of the military. It's an awesome thing to wear the uniform, but for Specialty Stories, I don't think I'm going to dive into it. So with that said, I hope you have a great week. Come back, check us out next week here at Specialty Stories.